Hello, everybody. Today I would like to share with you the concluding remarks that I've been providing at the end of the 36th French National Conference on Occupational Health and Medicine. This conference was in Strasbourg in June of 2022. And within this conference, I was part of the scientific committee, and I was responsible for one of the topics, along with my colleagues Laurence, Weibel, and Bernard Dugué. And our topic was about kindness in organizations. In French, the title of this topic was Une organisation de travail peut-elle être bienveillante, which could be translated into something like, could a work organization be kind or benevolent? I'm going to use maybe more the word kindness or kind. Benevolence would be maybe a better word-to-word translation of the word bienveillant. It's a little bit awkward to translate. By the way, it's a real work and a real job to be an interpreter or a translator, so I'll do my best. And I'd like to share some of the thoughts coming from all of the sessions, all of the posters that we had and keynotes within this big conference. We had about 3,000 participants to this conference, which makes it one of the biggest events in the field in occupational medicine in the world. So yeah. So first of all, there was this question of definition. What do we mean by kindness? So there was a definition provided in one of the posters, basically based on the expression bona viligentia. I guess this is from the Latin, and which would mean to apply good vigilance, to look after something, to be careful, which leads us to the possibility of preventing bad events from happening. One of the questions is also who defines what is good, what is kind, what is benevolence? Is it the employer, is it the worker, or is it the customer? And not all of the views are aligned within a given organization. Kindness in the world of companies, in the workplaces, is not just having a collection of workers aligned all together and individually trained trained to be kind using, for instance, positive psychology methods. It goes a little bit above this, beyond this. This way to see kindness in companies is a little bit frustrating because it differs on the individuals, something that should be taken over by organizations. Organizations have to be kind with their workers, and it cannot be just the workers individually that have to be kind to protect organizations that are not improved. So if we were, as occupational health professionals, going forward in this direction of the individualization, or going at an individual level and focusing on kindness of individuals rather than seeing this from an organizational perspective, we could help preserve organizations that are bad for the workers and not helping them improve to be better in terms of occupational health and safety. Another point is that kindness is not just avoiding conflicts. This is a little bit weird because most of the times we don't like conflicts, then we make kind of a link between conflicts of the workplace and not being kind and problems within organizations. So when I mean conflicts, by using this word here, I don't mean interpersonal conflicts. No, I'm talking about when we argue with colleagues, and that the tone we're using is not always nice, but sometimes behind those very challenging discussions we may have in workplaces, sometimes there are discussions that are disagreement on work questions. And it's not by hiding those disagreements that they're going to disappear. And having platforms, places where we can sit and discuss and have, those challenging conversations, this may be way helpful. So this has led us to hear from Bernard Dugué about organizational silence, le silence organisationnel, organizational silence, as a way to do some management in companies, which is kind of a policy that is based on having people not expressing disagreements, to give value to consensus, and to also dismiss when there are disagreements. And the thing is, with this organizational silence, workers are not going to report what their problems are. And the problem is that managers and leaders are not informed that anything is going wrong at the workplaces. So they may think that everything is going good. And all of this may lead to some industrial catastrophes, and some examples have been reported by Bernard Dugué. We also had another set of communications in various topics. I'm going to skip some of the content to shorten my presentation. One point that has been raised was about telework, or working from home, or remote work, as we call it. One of our speakers, Professor Valérie Boussard, she's a professor of work sociology. So Valérie Boussard told us about telework, and the thing is that there are many workers requiring or asking to be provided with telework, which may look kind to give access to telework, because telework is kind of good. We can manage our time as we please. We can have a running session after lunch and go back to work, or we can do our clean our laundry or things like this. But it looks a little bit less kind when we realize that actually men are more those having their running sessions, and women are those doing the laundry. Also, in the same time, we know that telework is a way to increase the pace of work. There is some work intensification with telework. Workers working from home tend to work more compared to work on site. They are overcommitted to their work. They feel a little bit of guilt by working from home. It's not really work. I'm doing things that are not directly work related, so I'm going to work a little bit more. And also, people may work on weekends, and even worse, when people are sick, they may also keep working using telework tools. Whereas someone who is sick is not supposed to show on site. So all of this is increasing the productivity of workers working from home. So all in all, these remarks are providing us with the idea that it's a little bit better if we don't stick to customer satisfaction when it comes to work-related mental health, when it comes to organizational problems. We need to look into what is discussed. We need to look into the risks brought by each organizational change that is provided, and we also need to have expertise to have a look into it. Occupational medicine and occupational health is not just taking the most popular solution proposed by workers, because even popular, this solution may raise down the road some occupational health issues. So this is very important to have some expertise on this field. I concluded this presentation and this summary of all of those communications by discussing one point, because the interventions in workplaces, because this is what's most important from all of this description, how we can do anything to change work organizations and make them look better, make them provide safer work environments. And to be honest, there's not a lot of progress. It's a little bit frustrating to see initiatives that are not carried down the road. There is some funding at some point with some director that is very concerned with occupational safety, and it lasts for a couple years, not to say couple months, and then it moves to something else, and another director comes, other priorities, and everything falls apart, and no one is interested in this topic anymore. This is not sustainable in terms of occupational health. We need to have some sustainability, some approaches that are more consistent down the road. And I think that it's time to look into regulations, more inspections, more control. If it doesn't come from the outside, there will be some businesses at some point doing good, but that's great. But it shouldn't be the exception. Like, all businesses need to provide a safe working environment from an occupational perspective. And so that's very important. But I'm a little bit optimistic, because recently the International Labour Organization has decided that occupational health and safety would be the number 5 category of fundamental rights for workers at the international level. And this could bring some positive developments in the field of international regulations pertaining to occupational health and safety. So that could be good to see how everything goes. So that's it for this summary of those sessions. All of the material is available in French, so if you don't read French, I'm a little bit sorry not to give you a little bit more details. My translation, all of my notes were in French, so I did my best to provide this, translation into English to share with you guys. If you have questions, or if there was something that was a little bit unclear, please drop a comment below, and I'll try to clarify. Thank you, and have a nice rest of your day.